Dear students, welcome back. In the previous session, we have discussed about scrotum in male external genitalia part 2. Now in this session, that is male external genital organs part 3, testis. So now in this session, we are going to discuss about the testis. The testis is the male gonad or male sex glands, and which is similar or homologous with the ovary of the female. And this testis is suspended in the scrotum. Testis is suspended in the scrotum by the spermatic cord. Okay. And it is having two poles, upper pole and lower pole. So the upper pole is tilted forwards and medially. The upper pole is tilted forwards and medially. Whereas in the case of left testis, which is slightly lower in shape and size. So if you compare with the right testis, the left testis is lower in shape and size than the right. Okay, so this is about the left testis. If you see the shape of this testis, the testis is oval in shape. So here you can find it is oval in shape. So this is the lateral view, and it is compressed from side to side. So it is compressed from side to side. Okay, and it is 3.75 centimeters long, and it is 3.75 centimeters long and 2.5 centimeters broad from before to backwards, and it is having a thickness of 1.8 centimeters from side to side. Okay, and adult testis weighs about 10 to 15 grams. Okay, so how the testis is placed inside the scrotum means, and the scrotum is suspended by the spermatic cord, and it lies obliquely. Okay, and it lies obliquely, and the upper pole, here the upper pole is tilted forward. Upper pole is tilted forward and medially. Okay, so this is the position of the testis inside the scrotum, and the left testis is slightly lower shape and size than the right. Okay, now we will see the external features of the testis. Yes, the testis is having two poles or two ends. So the testis is having two poles or two ends. One is the upper pole. Here you can find upper pole and the lower pole, and it is having two borders. One is the anterior border and another one is the posterior border, and it is having two surfaces. One is lateral surface and medial surface. So this is the lateral view. Here we can find the lateral surface here. On the other side we can see the medial surface. Okay, yes, the upper and lower poles. If you can see the upper poles and lower poles, these upper pole and the lower pole is convex and smooth. The upper pole provides attachment to the spermatic cord. So here you can see the upper pole provides attachment to the spermatic cord. Okay, if you see the anterior border is convex and smooth and is fully covered by the tunica vaginalis, a layer which surrounds the testis. The innermost layer which surrounds on the anterior border is the tunica vaginalis. Inside this, afterwards tunica vaginalis also, we can find some layers. Okay, that we will discuss. Okay, so the anterior border is convex and smooth and is fully covered by the tunica vaginalis. But as the posterior border, so if you can see the posterior border is almost straight and is only partially covered by the tunica vaginalis. So if you can observe this tunica vaginalis is going to cover not only at the anterior border, so it is also covering the medial surface as well as the lateral surface up to the posterior border. In the posterior border also it covers only partially, but the entire posterior border is not covered by tunica vaginalis. But the remaining part of the testis, that means anterior, medial and lateral surfaces, are covered by this tunica vaginalis. Okay, keep it in mind here. Yes. Next, the epididymus lies along the lateral part of the posterior border. So this is the epididymus. We are going to study this epididymus in detail. Actually, this epididymus is a highly coiled structure. So this highly coiled structure is present along the lateral part of the posterior border. Okay, so the lateral part of the epididymus, the lateral part of the epididymus is separated from the testis. Okay, the lateral border of the epididymus. Here you can find a space is present. Okay, a space which separates this epididymus and the testis is due to by an extension of the cavity of the tunica vaginalis. So that means this tunica vaginalis is covered on all the sides except at the posterior side. So a gap is formed in between this epididymus and the testis. Because of that layer, that space is called as sinus of epididymus. Okay, so how this sinus of epididymus is formed? So it is an extension of the cavity of the tunica vaginalis. Got it? Yes. So this is about the anterior border as well as the posterior border. Now coming to the medial and lateral surfaces. If you can see the medial surface and the lateral surface, this medial and lateral surfaces are convex and smooth. So these are the medial surface. This becomes the medial surface and this is the lateral surface, which here you can find the anterior border which is convex. So medial and lateral surfaces are convex and smooth. Okay, attached to the upper pole of the testis there is a small oval body called as appendix of the testis. So it is a remnant of the paramesonephric duct which is seen in embryonic life. After birth it is not seen. Okay, but a remnant is present on the upper pole, near the upper pole of the testis. Yes, so these are all about the external features of the testis. Now we will move on to the coverings of the testis. Okay, yes. So here the coverings of the testis we can observe in the transverse section of the testis and the epididymis, as well as on the longitudinal section of this testis and epididymis also. Okay, yes, we will see the coverings of the testis. The testis is covered by layers of the scrotum. In addition to the layers of the scrotum, the testis is covered by 3 coats. Okay, so first we will remember those layers of the scrotum. Okay, yes. So the first layer, actually the skin. isn't it? First the skin is present, after that dartos layer, that is dartos muscle, isn't it? And which is the modification of the superficial fascia of the abdominal wall. Yes, and next comes to the external spermatic fascia, and then cremasteric fascia, cremasteric muscle, and then internal spermatic fascia. How many layers? 5 layers. In addition to 5 layers, another 3 layers are coating this testis. That means totally 8 layers are covering the testis. Okay, so 5 layers of the scrotum and additional 3 layers are covering the testis. Okay, so now we will see those additional 3 layers. Okay, yes, from outside to inside. So this is the outside part, and to the inside, outside to inside, these are arranged like this. The outermost layer is the tunica vaginalis. Outermost layer is the tunica vaginalis, and next comes to the tunica albugina. So here you can find this tunica albugina, and the innermost layer is the tunica vasculosa. So this is the tunica vasculosa. Okay, so these are the 3 layers. If you see this tunica vaginalis, this tunica vaginalis represents the lower persistent portion of the processus vaginalis. So actually this processus vaginalis is the peritoneal fold, okay, which is an extension from the upper abdominal wall into the pelvic cavity, and which is extended into the scrotum as processus vaginalis. Okay, this is finally end up as this tunica vaginalis. Because of this is coming from this peritoneum, actually the peritoneal cavity is having 2 layers. One is the parietal layer and visceral layer. The same thing is exhibited by this tunica vaginalis also. And this tunica vaginalis is invaginated by the testis from behind, and therefore it is having parietal and a visceral layer with a cavity in between them. Okay, and it covers the whole testis except for its posterior border. So you can see in the transverse section the posterior border is not covered by this tunica vaginalis, and the remaining, so if you can see this anterior, medial and lateral sides, you can find this tunica vaginalis. So if you can see this longitudinal section also, so this becomes the posterior border. Here you can't find this tunica vaginalis. Okay, so here also you can't find this tunica vaginalis. Okay, this is about the tunica vaginalis. Now coming to the next layer, that is tunica albugina, which is dense white fibrous coat. Tunica albugina is dense white fibrous coat covering the testis all around. So this tunica albugina is going to cover the testis all around. That means on the posterior aspect also it is covered. Okay, and this tunica albugina is covered by the visceral layer of the tunica vaginalis. So here, so the outermost layer is the parietal layer of tunica vaginalis. This one is the visceral layer, and inside this one is tunica albugina. This tunica albugina is also covered by which one? Tunica albugina is also covered by this visceral layer of what? Tunica vaginalis. Yes, very good. So this is the outermost layer which is covering the tunica albugina. Again, except at the posterior part. Except at posterior part. Why? Because here at the posterior aspect, the testicular vessels, you can find this, the testicular vessels and nerves enter into the gland. Here you can find this. So here these are the testicular vessels and nerves will enter into the gland. Okay. Yes. The posterior border of the tunica albugina. So you can find this posterior border of the tunica albugina is thickened to form. So if you see on the anterior and lateral and medial surfaces, so what you can find more thickness on the posterior aspect, and it is forming an incomplete vertical septum. So here this incomplete vertical septum you can find here. So here it is forming some sort of septum and also some sort of septum here, but there is no complete septum like this. Okay, so it is forming incomplete vertical septum called as mediastinum testis. So this is the mediastinum testis. Okay, so this mediastinum testis, which is broader above. So here you can see which is broader above and somewhat narrower at the lower part. Okay, so the numerous septa extend from the mediastinum to the inner surface of the tunica albugina. So you can find the numerous septa which is extended into the inner surface of the tunica albugina. So here you can also find the septae here in this pic. Yes, so these are the septae, and they incompletely divide the testis into 200 to 300 lobules. And if you see the last layer and the innermost layer is the tunica vasculosa. This is the vascular coat of the testis. So this one is the vascular coat of the testis. Okay, and which is lining these lobules. So it is incompletely divided the testis into 200 to 300 lobules, isn't it? That each lobule is covered by this third layer, that is tunica vasculosa. Okay, these are the coverings of the testis. Now, if you see the structure of the testis, so now we will see the structure of the testis. The structure of the testis consists of the glandular part, and which is having 200 to 300 lobules. Each lobule contains 2 to 3 seminiferous tubules. So these are the seminiferous tubules. So you can find this seminiferous tubules. Okay, and if you see this, each seminiferous tubule which is highly coiled on itself. So if you stretch out, each lobule measures about 60 centimeters in length and it is having 0.2 millimeters in diameter. If you are going to stretch this coiled tubule, okay, like this, the length is 60 centimeters and if you take the diameter, which is 0.2 millimeters, the tubules are lined by cells which represent stages in the formation of spermatozoa. Okay, so the innermost layer of these tubules are lined by some specialized cells which represents the stages in the formation of spermatozoa. Okay, next. So if you see the seminiferous tubules, So these seminiferous tubules join together at the apices of the lobules. So each lobule, if you observe each lobule, which is almost in triangular shape, that means it is having a base and apex. At the apex region, at the apices of each lobules, okay, these seminiferous tubules join together to form 20 to 30 straight tubules. So which forms 20 to 30 straight tubules. So after forming the straight tubules, so these are the straight tubules which will enter into the mediastinum. So this is called mediastinum testis. So after forming the straight tubules, it enters into the mediastinum. So after entering into the mediastinum, it forms, so all these straight tubules once enter into the mediastinum to form a network of tubules. All will form a network here. So this is the network, and here you can find these are the network here. Network of tubules, okay, called as rete testis. What you call this network of tubules is called as rete testis. Okay, after forming this rete testis gives rise to 12 to 30 efferent ductules. So this is called ductules. So how many ductules? It gives rise to 12 to 30 efferent ductules which emerge near the upper pole of the testis. So this is the upper pole. So it is emerging out, okay, at the upper pole of the testis and enter into the epididymus. This is the epididymus. So the entire part up to here, this is epididymus. Okay. Each tubule becomes highly coiled. So what these ducts, isn't it? Efferent ductule, 12 to 30. Each ductule, okay, is going to become highly coiled and forms a lobe. So, and this becomes highly coiled and forms a lobe like structure which forms the head of the epididymus. Okay, the tubules end. So after forming all this highly coiled structure, and these tubules are end up into a single duct that is called as body of the epididymus and tail. Body of the epididymus and tail of the epididymus, and which is going to continue as ductus deferens or vas deferens. So this is the highly coiled structure and single body and tail, and it is continued as ductus deferens or vas deferens. So this is the structure of the testis. Okay, if you see the arterial supply of this testis, normally the arterial supply is done by the testicular artery. So this is the testicular artery, is a branch of the abdominal aorta which gives at the level of L2 vertebrae. It descends on the posterior abdominal wall to reach the deep inguinal ring where it enters into the spermatic cord. Okay. At the posterior border of the testis, it divides into branches, and small branches enter in the posterior aspect or posterior border, while large branches, medial and lateral, pierce the tunica albujina and run on the surface of the testis to ramify in the tunica vasculosa. Okay. So this is about the what you called as arterial supply. Now we will see the venous drainage of the testis. So the veins from the testis form the pampiniform plexus. So like a vine, okay, it forms a pampiniform plexus. The anterior part of the plexus is arranged around the testicular artery, the middle part around the ductus deferens and its artery, Okay, so here normally here this in this area. Okay, and then the posterior part is isolated, and then the posterior part is isolated. The plexus condenses into 4 veins at the superficial inguinal ring. So at the level of superficial inguinal ring, all these veins are going to condense into 4. Okay, and into 2 veins at the deep inguinal ring. When it comes to the deep inguinal ring, it is going to condense as 2 veins. Okay, so these veins accompany the testicular artery. Okay, ultimately only one vein is formed which is going to drain into the inferior vena cava on the right side and into the left renal vein on the left side. This is about the venous drainage. If you see the lymphatic drainage also in this thing, so the lymphatics from the testis ascend along the testicular vessels and drain into pre-aortic and para-aortic groups of lymph nodes. These are the pre-aortic and para-aortic lymph nodes here. Okay, which is seen at the level of second lumbar vertebra. So this is about the venous drainage. Normally the nerve supply to the testis is supplied by the sympathetic nerves arising from the T10 segment of the spinal cord, and they pass through the renal and aortic plexus. The nerves are both afferent for testicular sensation and efferent to the blood vessels. So what is the function of the nerve supply here? Here means the nerves are both afferent for testicular sensation and efferent for the blood vessels. So this is about the structure of the testis. Okay, in the next session we are going to see the applied anatomy related to the male genital organs. Thank you.